Now I'd like to introduce the moderator for the Q&A discussion with Dr. Salas and Dr. Hess, Yessenia, who is a climate director for the Climate and Culture magazine, Atmos.
Hello, everyone. Thank you so much for having me here. Renee, Jeremy, it's so great to be on this panel with you all. You did a wonderful job of summarizing the findings here. This question is for both of you. You know, you talked about the report stemming back to 2015, right? What was some of the most surprising findings in this year's report compared to years prior?
Well, for me, the most significant surprise with this year's global report was the extent to which the health impacts of climate change interact with other conditions, pre-existing and new. In this case, it's interactions between known determinants of health, poverty, lower social status, racism, sexism. The new condition of COVID-19, the global pandemic, has interacted in really dramatic ways with those underlying determinants of health. And when you throw climate change into the mix and you see increased intensity and frequency of climate sensitive hazards like wildfires and floods, droughts, and food insecurity, you see compound impacts. And I was surprised by the extent of that compounding.
Great, and I can take the US perspective. And so I think people might be surprised when they see 70 institutions and organizations working at the nexus of climate and health, recommending agricultural solutions. But I think that just really highlights how intertwined health is into everything. And so when we think about, sources of air pollution, I mean, people commonly think about transportation and cars and power plants and electricity. But as we showed, that the agricultural sector is actually nearly tied with transportation in regards to the greatest man-made production of air pollution that is killing people prematurely in the US. Now, this source of agricultural air pollution actually stems largely from ammonia, which comes from livestock, their manure, and synthetic nitrogen fertilizer that's applied to cropland. And so this ammonia actually combines with combustion produced by vehicles and power plants to create this particulate matter air pollution. So this just highlights that we can invest in sustainable agricultural practices that tackle climate change and reduce our greenhouse gases for a healthier future, but also that we can start saving lives today through those very methods by decreasing air pollution.
Right on. And for me as a reporter, what was really great to see was this attention on air pollution in the report. For there's been a time now that some public health experts have gone on to note that air pollution itself should be treated as a pandemic, right? And we're seeing the impacts now of unmitigated air pollution result in another pandemic, which is COVID-19, which is disproportionately affecting, as you all noted, Black, Indigenous, and other people of color in the US. Can you elaborate a little bit, Renee, this question's for you. Can you elaborate a little bit on the report's recommendations as to how to address this? I think that's one of the most surprising things for me to see is the recommendations touching on this intersection of issues.
Yeah, it's really been highlighting the interconnectedness, right, of everything. And, climate change and air pollution, they have the same root cause, the burning of fossil fuels. And air pollution harms health in many ways that has been really well understood. And we highlight that visually in the brief. But exposure to air pollution contributes to the development of worsening heart and lung disease, diabetes, disorders of the brain, and actually negative pregnancy outcomes like preterm birth and low birth weight. Now, many of these conditions have been shown to actually make people more vulnerable to severe illness and death from COVID-19. And so we discuss how communities in urban areas that have been historically redlined are actually exposed to more air pollution. And again, being plagued by these decades of racist polluting and their associated health harms. And so this may explain in part why studies are showing that those exposed to air pollution have worse outcomes for COVID-19. And that's, just to hit this point home, and that's why Black, Indigenous, and other people of color are dying at COVID that are rates higher than those of white people. But it also shows, again, that we can get to the root cause and solve the climate change crisis, in addition to solving the air pollution pandemic, as you appropriately call it. And we can do that starting today.
And of course, air pollution is a global crisis, right? It affects people not only in the US, and in some countries, the air quality is much worse than what we experience here in the US. Jeremy, what do the report's global findings show about the unjust impacts climate is having on communities in the global South? I think heat is one of those sort of like obvious impacts that we can see given just the way that the global South is just warmer, right, than communities here in the global North. But what are some impacts that perhaps are less known to the public, impacts that are affecting people today in the global South?
Well, we've known for a while that climate change represents a growing ethical crisis for global health. And this year's global report certainly confirms that. The report shows that climate change impacts are distributed very unequally around the world. Wherever we see climate-related hazards like extreme heat, storms, floods, wildfires, we see disadvantaged populations impacted much more dramatically. This is true for heat, as you noted. We saw this year in the global report that vulnerable populations were exposed to an additional 475 million more heat wave events in 2019 than were populations that were more secure. They, of course, suffered more heat, illness, and death as a result. We see similar impacts on worker productivity. This is borne primarily by lower income countries, particularly India and Indonesia. They each lost about 5% of their annual gross domestic product as a result of extreme heat impacts on worker productivity. We see similar trends for wildfire exposure, food insecurity, infectious diseases, particularly dengue. The impacts vary by location and by the populations that are most at risk in given locations. But overall, clearly we can say that climate change impacts children, it impacts elders, it impacts the poor, it impacts people with darker skin all around the world.
Definitely, yeah. And it's quite stark given the contributions from these populations, right? They have contributed the least to the climate crisis, many of these countries. And you both, as public health professionals, spend time in emergency rooms. You work with patients who are suffering some of these impacts. And I know that you both shared some of that during your remarks. Is there, I guess, a specific instance or memory that has stayed with you two that illustrates the way the climate crisis is already affecting people today, that illustrates just how unjust and devastating these health impacts can be on communities? I don't know who wants to start. Perhaps we'll start with Renee, since Jeremy, you started last time.
Well, I really appreciate this question, and I think it just really highlights the fact that numbers numb, but stories stick. And we have to recognize that there are human faces on all of these numbers. And people who are watching this, have personal stories potentially where they have been impacted or are currently being impacted. And so I think just one that really stands in my mind is in regards to an illustration of the fact that elderly and the poor are more vulnerable to extreme heat. So it was record-breaking heat here in Boston last summer, and a woman called 911 because her husband was acting confused. And the ambulance crew said that when they climbed up to the top floor of their lower income housing, that they opened the door and were hit with a wave of heat that felt like the Sahara Desert. And we weren't able to afford air conditioning, so they only had one window that was partially cracked. Now, this man was rushed to my emergency department where we met him at the bedside and got a rectal temperature, which is the best way to get a true internal core temperature. And it was 106 degrees Fahrenheit. So this man's body was failing under the extreme heat exposure, and he had heat stroke, which is life-threatening. And so I think that he really highlights the vulnerability of the elderly and the poor. But I often think about his wife, because she really represents who was left behind.
Thank you, Renee. How about you, Jeremy?
Well, I'm going to tell a different but related story, which is more about the general experience that we have as emergency physicians. I work in a level 1 trauma center. We provide trauma care for 5 states in the Pacific Northwest and Alaska. We're also a regional burn center. We're a center for excellence in stroke and cardiac and psychiatric emergency care. We have pressing demands constantly. And we also have a really clear mission to take care of the most vulnerable. And what I see every day is overlapping burdens of poverty and injury and environmental exposures on all of these different populations. And of course, we see more asthmatic patients fighting to breathe when pollen counts are high. We see more patients who have been burned and suffered from smoke inhalation when wildfires get out of control. Our EMS services see more patients with sudden cardiac death. All of the impacts that Zach talked about, we see whenever we have increases in any of these climate sensitive hazards, which we're seeing much more frequently. When it's really hot, we see more exacerbations of chronic disease, exactly like the patients that Renee described. But the overall impression that I'm left with after work is the compounded impacts and burdens that our most vulnerable populations experience from all of these overlapping vulnerabilities and exposures. And climate change is increasingly adding to the mix.
Of course, right. And there's the added impact, right, that the health professionals are facing, the sort of mental health impact of seeing this, I think, daily in the emergency rooms, which I think isn't often talked about. But now it's being more of a talking point given COVID-19 and the personal impact that the virus is having on health professionals. So I appreciate you all and the work that you do. I wanted to talk a little bit more about the recommendations here because they're quite ambitious, right? How do you all feel about how likely it is that our leaders will listen? After all, the recommendations here are recommendations that climate scientists and climate justice advocates have already pushed and have already noted need to be done. So you all are not the first to say that we need to decarbonize, remove fossil fuel subsidies and improve public health. What is the general sense here of whether leaders both in the US and globally will take the necessary steps to make these recommendations reality?
Well, we're certainly not the first to be saying these things, as you note, and it's not for the first time either. The incoming administration in the US clearly is guided by science, and the Biden climate plan lays out aggressive climate action. This is going to reduce the likelihood of dangerous climate change if they're able to enact what they've laid out in the plan. And it will reduce many of our vulnerabilities. There also is a plan to re-engage with the global community and to try to make good on the commitments that we made originally related to Paris. The extent to which we will leverage health as a central theme in this effort remains to be seen. It's not as prominent an organizing principle in the materials that I have seen as I would like, so that's an open question for me, but I certainly welcome the embrace of science and the urgency around climate action. It's overdue.
I am enormously optimistic that this is the moment that we will act and do what needs to be done. I mean, I think we have really fertile ground to advance the discussions. And, as Dr. Hess outlined, health is central in our society, really in an unprecedented way. And climate change is increasingly being framed as the health crisis that it is. And that makes it personal because it's not about a polar bear or an iceberg. It's about the health of your children or your aging parents, or if that's not enough, then yourself. And we're also at a moment of really extreme, I think, regret in our country because we have seen what plays out when we ignore the science and delay action. I mean, people get harmed and die. And I think that we want to prevent regret on climate change. And the movement is growing and the ground is shifting in really unprecedented ways. And so I believe also that health professionals are really that critical catalyst that can move us. We have clearly shown through our experiences, both of the pandemic and climate change, that science and data alone is not enough to act. But health messengers are trusted, and they have the unprecedented skills with which to engage one-on-one to make climate change critical and to really make health that common denominator, common ground that we can all stand on and put health first and as the central driver for why we need action on climate change. And we are at a moment with an administration that's listening. And so the time is now, and we can do this.
Dr. Salas, Dr. Hess, our time is up, but thank you so very much for your expertise on this matter. It's been my pleasure.